Hi everybody, Dr. Pane here, and this is going to be the first of a two-part discussion on getting cosmetic plastic surgery when you have a history of particular medical conditions. So for the first part, I want to talk about HIV and hepatitis. If you have either of these, some people have both, but it is not a disqualifier for cosmetic surgery in my practice. Now, technically speaking, practices are not supposed to turn people down on the basis of their having any of these conditions. The fact that it does happen in real practice that's a different topic altogether. In our practice, everyone's welcome. What we do is make sure that the condition has been adequately controlled, treated. Hepatitis, there's different varieties of it. Some of it is basically food poisoning, hepatitis A, and you can clear that. Hepatitis B actually has a vaccine available, and hepatitis C is something that used to be much more a problem in the past, and actually they've done remarkable work, and it's treatable now. So the basics for that is if you have that condition, what we need is we're going to have to interface with your primary care and the specialist, the infectious disease specialist that manages you, and make sure that the condition is under control. If it's adequately controlled and there's no big issue, then you're a candidate. Simple as that. If you have any issues as a result of it that make it so that you're not a candidate in an office-based surgery setting, but you are a candidate, say, either in a hospital setting or an ambulatory surgery center setting, both, I have privileges in all three settings, then we would take a look at that because maybe we have to do your surgery somewhere else. And with HIV was something that was a real big scary problem when it first emerged. The work that the researchers and the pharmaceutical industry and so forth have done to essentially transform this into a controlled medical problem is nothing short of amazing, actually. And now people can have it controlled so well that they essentially can't transmit the infection. So again, just like with hepatitis, if you have HIV and you're otherwise a candidate for cosmetic surgery, that's not a problem. What we need to do is get you cleared with your primary care doctor and the infectious disease specialist to make sure that everything is set. And again, if those things are in place, there's no problem with having cosmetic surgery. And that's it. So if there's any other questions related to that, let me know. Otherwise, we will see you for part 2 of this topic where we cover other medical problems.